have your both permission to use this video for educational purpose and on internet?
Yes.
Tell me about your symptoms before the surgery. How were you doing?
I couldn't hardly walk.
Like how far could you walk?
Maybe
25 feet to 50
25 feet, yeah. Mostly around the house, so to
yeah,
say.
yeah.
enough to get to the bathroom and back.
Oh,
Yeah.
God, yeah. And were you in pain when you
Yeah,
were walking?
yeah.
How bad was that pain?
Oh, I think 10 plus.
10 plus?
Yeah.
Now,
yeah.
let's fast forward. How bad is the pain now?
It's about, if I get pain, it's probably 4 or 5.
And that is when with certain activity.
Yeah, yeah.
Specifically, before the surgery, you had leg pain. Do you remember where the
Yeah,
leg pain was?
Down here, here.
How is that?
That's gone.
That's
yeah.
gone. Now, the surgery just was 3 months ago. You said you had that pain almost 10 years.
Yeah.
And then we did just 3 months ago this surgery. I have the record of the surgery here for us. Do you remember the surgery?
Yes.
How long did you stay in the hospital?
6 days, I think.
6 days?
Yeah.
That's usually a lot more than usual, but
Yeah.
I think it was the problem that, what was the special problem that
My leg.
your leg, your ambulation.
Yeah, it was
So
weak.
you see, most of my patients go home next day,
Yeah.
but sometimes this is realistic.
Yeah.
You have some problem, especially you were weak in the left
Yeah.
leg right after the surgery.
Right. Right.
How is that weakness now? I just checked that is much better.
Yeah, it's
but
much better. Yeah. It's.
Yeah.
I just need to have physical therapy to make it stronger.
yeah, now as well. So practically, this is the record of the surgery. The surgery itself was about less than 1.5 or 81 minutes, and we actually lost less than a cup of coffee blood. That's all what we lost.
Oh, okay.
But as we talked about, 1 in 7 patients, 15%, they can have some symptoms in the left leg,
Yeah. Yeah.
which about 80% or more actually get better after a month or two. And
okay.
in your case, I think it's as well in the same time frame that weakness is getting better.
Yeah.
Do you have any numbness or tingling in the left
No,
foot anymore?
no,
No, that's gone.
no.
Okay, good. Now, this is actually the picture that we got today. Here are, as we see, the bone starting beautifully growing. And I'm going to close in here, inside, and as well, your side bending is gone, and this is the down view. And these are the screws in, they're perfect. But as well, bone in the back start growing. And this is something we usually expect after almost 9 months to a year with open surgery. So I'm very happy with what I see. And look at the screws are exactly where they are supposed to be, doing exactly what they're supposed to do.
Is my scoliosis better?
Yeah, it's
Yeah.
gone. You don't have, for
Oh,
practical
okay.
purpose, you don't have any
Okay.
scoliosis anymore.
Okay, good.
So I'm very happy with what I see inside. Obviously, in your case,
Yeah.
most of our patients don't have it. You had that nerve
Yeah.
irritation on the
Yeah.
left, which is
Yeah.
already getting better,
Yeah.
but that's a realistic expectation.
Yeah.
That 3 months later, your walking is getting better. What do you notice with her walking and daily activity? What do you notice
Well, I noticed she could walk around the house better than
than before? Yeah, you still need some, probably it's a good idea to use a walker or
Yeah.
some aid. So,
Yeah.
and obviously physical therapy is important to
Yes.
help you to recover. Now, one last question. In that last 10 years when you had that pain, did you see any other surgeon, or without telling the names, did you
Oh,
talk to
no.
anybody else?
All my doctors said they wouldn't even touch me.
They
you
wouldn't
know?
even touch you.
Yeah.
Did they tell you why they wouldn't touch you?
Because it was so severe in the back that
It
they'd
wa-
have to, the discs were so worn down.
Yeah. And that was a complex surgery. And the reason we could do that is because we do it with small incision, whereas other surgeons, if they have to open it up, that's much bigger surgery for
yeah.
them. Now, I'm overall so far happy with the results.
Yes, yes.
So, and daily activity, for most of your daily activity,
It's getting better.
it's getting better.
Yeah, it's
Okay.
getting better. I just have to, I've done things in the kitchen and stuff, and
Yeah.
I just work around my walker for now.
Yeah. Now, it took you 10 years to get really help with this,
Yeah,
right?
yeah.
Would you wait again?
No.
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 Well, I'm very
I thank
happy.
you for the surgery. I don't know how you did it, but Thank you.
Well, thank you very much for the
Yeah.
interview. I really
Yeah.
appreciate that.
Thank
I
you.
think
Okay.
with the other
Thank you very
surgeons and
much.
that, they just didn't even want to do it because it was too complicated or something.
Yeah.
So it's
Now, as part of that, most surgeons are really good at weighing risk versus benefit. They probably did you a favor not to doing the surgery
Yes,
because
I
open,
think so.
old-fashioned traditional surgery would be a lot riskier.
I had a sister-in-law who had that kind of surgery,
And
and it was terrible. for
yeah,
her.
most of the time,
Yeah.
especially sometimes as well when our body mass index, we can
Yeah,
call it, is
yeah,
get higher.
Yeah,
Do you know what your body mass index is?
yeah, I know what it is, 50-some, I think.
Yeah, so
Yeah.
and that's one of the reasons
Yeah,
they didn't want to do the surgery. And
Yeah.
in that case, they actually did you a favor
Yeah.
not to do
Yeah.
the surgery because we
Yeah.
know those surgeries in higher BMI, or regular surgeries don't go
Yeah.
well.
yeah, because
Okay.
the pain with this was minimal, I mean, really.
Many times, but with this surgery, pain was minimal, but with open surgery, because we do more
Oh,
cutting,
yeah,
it can be not only pain worse, but the risk of infection much higher and so on.
yes,
And in that case, that is why we can provide this care to patient that nobody else can.
Yes.
Okay. Well, thank you so much
You're
for the
welcome.
interview. I
You're
appreciate that. Okay.